Hello there. It's lovely to meet you. I'm Dr. CalmingEscape. Welcome in. So, your adult tells me that you're a little nervous today to be coming to the doctor. Okay, that's alright. Everybody gets nervous. Okay, we're just gonna do a little check on you to make sure that you are nice and healthy, and to make sure that you don't get any more nervous. I'm going to explain everything that we're doing and make sure that it's okay with you. Okay. Sound like a deal? Perfect. And if at any point you need a break or you have a question, you can ask me. Good. So, if we look back behind me, you can see the human body. And that's what we're looking at today, just to make sure that the various parts of your body are working how they should. Exactly. So, we have the skeletal system. That's like our bones. Yeah. We have the circulatory system. That's kind of our veins and our heart, kind of like little roadways for our blood to travel throughout our body. Yeah, so it can drive through all of our different parts. Then we have the respiratory. That's how we breathe. Every time we breathe, we fill up our lungs. We have the digestive system. That has to do with like when we have breakfast or dinner and how we eat the food or drink something and it goes into our body. And then how our body processes it. Yeah. Then we also have the nervous system. And that's connected to our brain. And it has lots of different nerves throughout our whole body. Good. So, here you can see a couple things that we'll look at today. For instance, the human body has 206 bones. All the bones in your body are called the skeletal system. Now, we're not going to check all 206 bones, but I will check a few. Have you ever broken a bone before? Understandable. What color was your cast? That's a good color. I like that color. Your heart pumps blood around your body and beats around 100,000 times a day. So, your heartbeat, you've heard that before? Maybe when you're running around at recess? Of course, that keeps us going and pumps our blood along those roadways we talked about throughout our body. Your lungs take in oxygen from the air you breathe. They can hold about as much air as a basketball. Do you play basketball? I used to when I was a kid. So think about if you breathe in, that's our lungs filling up. The digestive system breaks down food so your body can use it for energy. So when you get that energy after lunch, maybe at recess, that's your body using those food and nutrients to give you that energy so that you can go and run around. The brain is the center of the nervous system. The brain of an adult weighs about 3 pounds. So my brain weighs about 3 pounds. Yours would be a little bit less. Yes, well, I'm quite a bit older than you. Your 5 senses help your body observe and communicate with the outside world. And we'll be checking those 5 senses today, too. Have you heard of those before? That's okay. So we have sight with our eyes, hearing with our ears, with your ears, smell with our nose. Touch, feeling, touch, maybe with your hands. And taste with your taste buds on your tongue and in your mouth. Okay, so throughout today's exam, you can look at the chart behind me and kind of see what we're looking at next. Perfect. So to start off, if it's okay with you, I'm going to touch your face. Is that all right? I'm going to put on these blue gloves. Blue is my favorite color. So they're kind of like plastic, sort of, but against your skin, they will actually feel pretty soft. So, should feel quite comfortable for you. Now I'm just going to use my fingertips to touch different parts of your face. Okay. If anything's uncomfortable, you're going to tell me. Good. That feel all right? Good. While I'm looking at your face, we're going to make some silly faces together. Puff out your cheeks. Yeah. Stick your tongue out. Smile great big. Let me see those teeth. Good. Can you frown? Good. Now close your eyes tight and don't let me open them. Yeah. Fight, fight, fight. Good job. Good job. Very good. Just look at the side of your ear here. Any pain in your ears? That's good. Sometimes we get earaches, which is normal, but we just want to make note of that so that me, as your doctor, can know how your ears are doing. Good. Now close your eyes for me. Can you tell me which side of your face I touch? Yeah, I tricked you on that one. Okay, good. You open up, say ah. Okay. Yeah. Say ah, stick your tongue out. Good. Good. Any loose teeth lately? Did you leave any of those for the tooth fairy? Alrighty. Now, I'm gonna look at your eyes. I just want you to look right at my nose. This is a flashlight, so I'm just going to use the flashlight to look inside your eyes, okay? Good, right in my nose. Good. Very good. Do you wear glasses? Okay, I'm just going to move a little closer to you. Good. Really good job. All right. Now, you seem like a pretty smart human. How are you with numbers? Yeah? We can count on our fingers? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. So, I'm going to hold up some numbers now. With my fingers. And I want you to tell me what number I hold up. Alright? What number is that? Good. That. Good. 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 Perfect. Now, don't move your head. You're just going to keep your head still. But follow my finger with your eyes. So I just hold my head still and I follow with my eyes. My eyes move back and forth or up and down, but my head stays still. Okay, good. Good. Wonderful job. You did really well with that. Okay, I'm going to go ahead and whisper some words into your ears, and if you can just repeat them back to me. Good. All right, you ready? Unicorn. Bumblebee. Purple. Banana. Car. Yellow. Bumblebee. Good. Doing really good with that. Alright, so this here is my stethoscope. Most doctors you see will have this. I put these parts right here into my ears, and this part helps me to listen to various parts of your body. I'm going to listen to your heart today, your lungs, and maybe your tummy too. Okay. Let's just make sure this is warm for you. Okay, you can just sit there to relax. I'm going to listen to your heartbeat. Good. Now I'm going to listen to those lungs. When we talked about the respiratory system, I'm going to listen to those lungs now. Okay? I'm going to listen to your back. Still listen to those lungs, but I'm just going to reach behind you and listen. Good. Now, we're going to take a nice deep breath and fill up those lungs for me, okay? Ready, and... yeah, keep doing those nice deep breaths for me. You're doing really well. Good. Okay, good. Now, anytime when you're outside playing or running around, does it get hard to breathe for you at all? Good. Good. Okay, next I'm going to still use our stethoscope here, just like what we did, but I'm going to listen to your tummy now. Any tummy pain today? Okay, so I'm just going to move this along your tummy, and we're going to kind of listen to some of those digestive sounds. Okay, Perfect. Okay. Yeah, you're doing really well. You still nervous? Good. You look a little bit more relaxed. Okay, that sounds really good. Now, if it's okay with you, I'm just going to take my hands here and I'm going to press along your tummy. Okay? You'll let me know if anything doesn't feel good. Okay, good. Alright, you're just going to feel my hands here and we're just going to press. Press. What did you have for lunch today? That sounds good. Is that your favorite? One of them, yeah. I know a lot of us have a lot of favorite foods that are really yummy. Does that feel okay? Good. Okay. Perfect. Now, I'm going to have you kind of move your body a little bit. We're kind of looking at some of the bones and the nerves. Okay, so let's go ahead and stick our arms out. Straight out, straight out. Good. Don't let me push them down. You are strong. Look at those muscles. Perfect. You can put them back down. Turn your head to the side and back. Side and back. Can you look up to the ceiling and look down at your toes? Good. Put your leg straight out. Okay, and this leg straight out. Down. Good. Good. Now, can you just twist at your waist here, right at your tummy? We're going to turn to the side. Good. And what about the other side? Good. Very good. Now, the next part. Some people might think that this looks scary. It's kind of like a little hammer, but you can feel it. It's just a plastic. It doesn't hurt. See? We're just going to tap this reflex hammer along different parts of your body. And we're going to look for a little twitch, basically. So basically, if you hit a certain spot, your hand will go like that, or your elbow, your knee, various points on your body. And that just tells us that your reflexes and everything is working how it should. Is that okay? Perfect. So I'm going to take hold of your arm. We're going to hit your elbow first, but remember, it doesn't hurt. Okay, ready? Good. One more time. Good. Same thing with this side. The elbow once again. Ready? Good. One more time. Good. Now we're going to do the same thing with your knees. We'll start with this knee here. Are you ready? Good. And we'll do this knee. Good. Now, if it's alright with you, I'm going to tap the center of your forehead. It's kind of silly. Yeah? Okay. Ready? Good. Perfect. Now, can I see your palm real quick? Yeah, I'm just going to run the end right like that. Now, how does that feel to you? Cold? Yeah. Little sharp? Yeah. Good. Does it feel the same thing on this side of your hand? Good. Now can you feel the difference between that and this softer plastic end? Much smoother, exactly, good. And the same on this side. Good, really well done. Alright. Now, this little guy, I have a little baggie here. It makes noises for us. So this will test a little bit of your hearing, and I also want to see if you can feel when it vibrates. So this is a tuning fork. So it's metal, and I'm going to use this to hit it, and it will play kind of like a music sound. Okay? See? But it does that by vibrating. So it's vibrating to make that sound, but when I stop it, it stops vibrating. That makes sense? Good. So close your eyes for me. Tell me when you can't hear this tuning fork anymore. Okay. Can you hear it now? Good. We'll do that again. Hear it now? Good. Hear it now? Perfect. You can open your eyes. I'm just going to place the end of this tuning fork right on your forehead. Tell me if you can feel it kind of vibrating, okay? Can you feel that? Good. Tell me when it stops. Exactly. Same thing. Tell me when it stops. Good. One more time. Tell me when it stops. Good. You did a really good job with that too. So I have this little vial here, and I want you to smell it and try and tell me what it smells like to you. Okay? Here you go. Smells like candy. That's good. It's vanilla. Do you like vanilla ice cream? Good. Okay. And what about this one? What does this one smell like? Peppermint. Good. Do you like peppermint? Perfect. Alright. I think we are all done for the day. You did so well. Yeah, there was no need to be nervous. You did fantastic. Right. So, we'll do another checkup like this next year. And if you don't feel good or something like that, I might see you sooner just so we can get you healthy again. But if everything stays how it is, you look super healthy and everything in your body, all of the various parts that we looked at are working like they should. Perfect. So in a year's time, I'll see you to look at these parts of the human body again. How's that sound? Perfect. Well, you are all set. Please be sure to stop by the front desk and you can get a lollipop or a sticker, or you can get both if you want. Okay. You have a wonderful rest of your day.